as the Secretary of Indian Society of Psychiatric Nurses, to welcome you all in this August meeting. We have gathered here for the 22nd Annual National Conference of ISPN in collaboration with Institute of Nursing Education, Goa, Directorate of Health Services of Goa. When we conceptualized this program, when we asked Mr. Wilson, Dr. Wilson, that we will conduct here at Goa with the available infrastructure in the institute, he was readily agreed, and we started proposing. The first and foremost, we wanted to know whether our Honorable CM Sir would be available for this program. When we approached him, he was very kind enough. I think he is being a medical person. He understands the value of nursing and nurses. And he immediately accepted. And we got his confirmation through his PA. And we started progressing with all the arrangements. Sir, we are indeed very honored to have you here for this August function. We have with us Dr. T. Dilip Kumar, the President of Indian Nursing Council and the patron of Indian Society of Psychiatric Nurses. Sir, you are always with us. Your guiding and motivating words keep pushing us to do many more achievements. In fact, every year when I present the annual report, Sir used to come and say, yes, whatever I have seen last year, so many things you have achieved, but these are the agenda. So he sets agenda for us. Sir, we are indeed proud to have you here for this meeting as a guest of honor. We have with us the respected Dean from the Goa Medical College, Dr. Bandekar ji. Sir, we are proud to have you in this evening along with our CM. Madam Dr. K. Redamma, the pillar of ISPN and the founder, president and president continuing for ISPN. Madam, indeed, your support and encouragement are always with us and your blessing takes us forward. We welcome you for this function. We have Dr. Wilson Fernandez. Dr. Wilson, your approach and your kindness always be with us. And you are welcome for this function, and without you, this would not have materialized at this place. I welcome the Joint Secretary, the EC members of ISPN, and my teacher and beloved Principal, Madam Rajeshwari here. And also, we have the Goa Nursing Council members, and also we have so many other institution heads who are participating in this program. We welcome you wholeheartedly. And the whole idea of having the conference is for the delegates. Sir, we are proud to say that we have delegates from more than 21 states. We call them as quality crowds, and they have come here with a lot of expectations in this conference, and they contribute a lot. We learn from them. So, we welcome everybody who has participated in this conference. Once again, welcome you all. Thank you.
Thank you, sir. As a welcome token of appreciation, I request Ms. Consi and Ms. Madam Maria Ferran to award the saplings to our dear CM, Dr. Pramod Sawant. To Dr. T. Dilip Kumar. To Dr. Bandekar. Dr. Redemma, to Dr. Radhakrishnan, to Dr. Balamurugan, and Dr. Vincent Fernandez. Thank you. A belief common to all and undeniable that when an auspicious lamp is lit, it calls for prosperity, welfare, and positivity in and around us. To consummate this belief, I request His Excellency Dr. Pramod Sawant, Honorable Chief Minister of Goa, and other dignitaries on the dais to step forward to light the lamp. I request Ms. Maria Ferrão and Ms. Konsi Vaz to assist with the requirement.
Photographer 30
Thank you, sir. Tomorrow will come if you survive. Take one step at a time. Dear audience, we are well aware of individuals giving up as they lack in the art of handling stress, to relate to others, and to make healthy choices. Being a health person, we understand the significance of mental health and how it plays a major role to help individuals in need. This conference has encompassed the concept of mental health with a theme. To enlighten us on this theme, I am pleased to introduce to you all Dr. Konduru Redemma, President of ISPN. Madam started her journey in the field of nursing with academic excellence. After securing an A grade in master's program, she went on to complete her PhD studies in nursing. Her contribution at NIMHANS is invaluable. She has been a vital member in curriculum development for the Diploma Neuro Nursing and MSc Psychiatric Nursing from the year 1982 and 1988 respectively till date. She is the Nodal Officer of the National Consortium for PhD by IMC from 2006 till date. She has been a resource person at national and international platforms. She has around 25 publications to her credit, both in national and international journals. She has been a recipient of Silver Jubilee Award for her services at NIMHANS and Golden Jubilee Service Memento from INC in the year 2000. Madam, we are honored to have you here. I request you to unfold the theme of the conference and enlighten us on the same.
Respected CM sir, we are honored with your presence here. Thank you very much for accepting our invitation. And our President, Indian Nursing Council, has always been with us under all circumstances for all our webinars, annual conferences. Sir, your encouragement is making us to grow day by day professionally. Sir, Dean sir, I am very thankful to you for being with us. And my colleagues here, EC members, who need no introduction, and all of them are equally efficient, and all of them are dynamic, and anytime, any request from the society, you can say that it is done. So that is how all of them function. And Mr. Wilson, thank you very much for taking up this responsibility. And maybe we will, I think it is the first time this kind of conference is going on in Institute of Nursing Education. May you be equipped with conducting more and more such events so that knowledge can be shared among the nursing people. Well, today we are here to inaugurate this function, and the theme is role of a nurse in promoting mental health lifespan approach. As all of us know, mind and body cannot be separated, and the mind affects body and body affects mind. It is just a simple fact that we should remember. Well, as nurses, you cannot compartmentalize your skills from OBG to pediatric or medical surgical, community or psychiatry. It is intertwined to take the individual towards the path of recovery. Let us take the theme being lifespan approach. And let us take from womb to tomb approach. During antenatal period, so many changes have come up from the time that we seniors learned about these subjects until today. My request to you is, now public is very well educated, well informed, and they will have so many questions to ask you. Are we above this? Are we able to answer their questions? Are we able to convince them with our answers? These are some of the questions you have to put to yourself. Are you keeping abreast of your knowledge and skills? We had a lot of problems with the antenatal care, MMR, and I still remember in 80s, people, there were death rate of 60 to 80% of the women with cortical venous thrombosis. With specified course of treatment, we have been able to bring it down to 6 to 8%. This is a survey that I have conducted by doing case-file review of the patients who have been admitted to NIMHANS. What were the reasons? One was the viscosity of blood, and second was anemia. So these two were causing deaths among postnatal women after the delivery. Why? Socio-cultural habits. Women were deprived of being given a lot of fluids, and they were not given fluids. They would give once or twice a day. So the public education on these issues in the society has brought in a lot of changes. Now we don't see many of such occurrences. And let us take children. So many of them, we used to see the number of cases of cerebral palsy. Now we don't see that many number of cases. And we have to see how the dynamism of research is helping to bring down mortality and also to bring down the rate of occurrence of any particular disease, or it is helping them for better recovery. And let us look at the psychological needs of the individuals at different stages. During infancy, utmost care is required, and once the child starts being independent, we see that changes in the frequency of occurrence of any illness comes down. And as nurses, you have to share from each other what you can give to the other person who is working in a different specialty. It has to be intertwined for human welfare or human dignity and welfare. Let me tell you, if we approach any work being burdensome or difficult, it is going to be burdensome and it is going to be difficult. But if we approach the positive attitude that it is not going to be burdensome, it is going to be a pleasure, it is going to be a pleasure. And working at LIMHANS, I had tough time in making general physicians to examine my psychiatric patients. I have to go to each and every general hospital to convince the medical superintendents, please take care of my patients when they have physical problems. And there were occasions where they refused, some of the hospitals have refused and were not willing to get them admitted. But after that request, they have accepted them for justice. Because mentally ill also have physical problems. So that was at time, it was considered as an isolated way of treating the psychiatric patients. Now, then the issue of the shifting to general hospitals, having psychiatric units in the general hospitals have come up. So with that, the acceptance of mentally ill has definitely improved, and now various district mental health programs have come up. Now we are at a stage where telemanas, that is counseling people through teleconference mode. And here is our Dr. Balamurugan, who has been recently selected as faculty in telemanas. So it is a multidisciplinary team, and we are at a stage where it can reach through net. And people are also aware of, and they are very, very tech savvy, and they will be able to make use of the services of specialists in different areas. I think with this unfolding the theme, I request you to enjoy the deliberations, go back, rich in your knowledge, and have the feel of Goa, and enjoy your presence here, both professionally and socially. Thank you very much.
Thank you, madam. We have been enlightened on how cultural habits have an impact in maintaining our mental health and to adopt a positive approach to sustain stressful environment. ISPN is a renowned organization involved in various activities contributing to the upliftment of mental health and creating awareness of mental illness. I call upon Dr. Balamurugan, Joint Secretary of ISPN, to present a report of the organization's activities.
So very good evening to all. Hearty welcome to the people, dignitaries on the dais. Now the dais, I take this opportunity and I feel privileged to talk about ISPN. So Indian Society of Psychiatric Nurses started in the year 1991. It's a professional society of mental health nursing and allied health professionals registered under Societies Act. This society is meant for the professional and scientific development in the field of mental health nursing. As on today, we have life members of ISPN 2,400 plus and associate life members 120 plus, and 12 fellows are awarded till now. As the objective of ISPN, we disseminate the knowledge and updates to the mental health professionals. We regularly conduct conferences, and we publish a journal called Indian Journal of Psychiatric Nursing. Stepping into the 17th year, when we partners with the Waterloo Blues International. It's completely peer-reviewed journal. It's listed under UGC Care List, and soon we are going to get PubMed indexed. We have an MOU with ISPN Psych International. It was finalized in 2020. Main objective was collaboration for sharing knowledge, research and advancement. Not only that, Indian Nursing Council and ISPN India joined hands together for the support of nurses who are working in the COVID-19 battlefield. We did a telephonic consultation. Around 50 experts of mental health nursing are identified, and their contact numbers, preferred language and time were shared with all the nurses registered under NRTS portal. INC helped us to communicate this information to all the nurses under this portal through SMS and email. And most of the nurses in the field of COVID-19 wards, they access this service. And main focus was to reduce the stress and burnout among nurses in COVID-19 period. And also we have a learning center called ISPN Learning Center. With the help of Moodle platform, we are running this. Currently we have 32 videos, modules, around 68 minutes, one course is available. And we do honor the young scientists in the name of Sarla Kapoor Young Scientist Award. And we do felicitate the ISPN Fellowship Awards. And every conference, we identify the best paper and award as well as the best posters also. So the benefits of ISPN Life members are they can get a special registration fee concession, and they can avail 50% concession on the journal subscription. They can contest in the Young Scientist Award, plus they can organize CNE at the regional level. After 10 years, a member can apply for ISPN Fellowship. The future plans of ISPN are, we are planning to establish a research grant for mental health nursing research, strengthening the regional presence in ISPN membership, increasing the number of executive members and revision of the structure. So about this conference, ISPNCON 2023, so it's going to be there for 2.5 days from 24th to 26th, 2023. And as Dr. Radhakrishnan said, we have delegates from Kashmir to Kanyakumari. The whole conference is split into two areas. There are 10 scientific sessions. Experts are deliberating about 10 different topics of lifespan approach, plus one panel discussion. And not only that, we have around 39 scientific papers we received from the delegates and 17 posters. So with this, I take this opportunity on behalf of the Pattern, President, Secretary and all the EC members, I would like to thank each and everyone who gathered here. Thank you.
This was informative. Thank you, sir, for taking us through the activities of ISPN. Taking our evening further, I consider it an honor to introduce the President of the Indian Nursing Council and patron of ISPN, Dr. T. Dilip Kumar. Sir has a long-standing of 43 years of experience in the field of nursing and worked in different capacity. He has been instrumental to make India member of the International Council of Nurses, has been active in developing module of nursing care in emergency section, proactive in curriculum development for training nurses in HIV and AIDS, initiated projects like development of QAM in nursing, National Consortium for PhD in nursing and nurse midwife practitioner program, has been the power force to operate and strengthen schools of nursing, training of nurses and revival of National Award to Nursing Personnel awarded by the President of India. He also holds the record of being the first nursing professional as the member of the Global Advisory Committee of World Health Organization. Sir, I'm glad to invite you to address the event.
Good evening to all of you. Greeting from the Indian Nursing Council. Honorable Chief Minister of Goa, Dr. Pramod Sawant ji, Dean of the Goa Medical College, Dr. Sawant ji, Dr. Redamma, Dr. Balamukkan, Dr. Pramod Sawant, and also the Wilson Fernandez, and distinguished invitees, distinguished participants from the different parts of the country, my dear students and ladies and gentlemen. First of all, I would like to congratulate the College of Nursing of Goa for holding this very important annual ISPN conference, which we have not left in a single year. Again, this is happening in the backdrop of, you all know that how World Health Organization has declared 2020 as the International Year of the Nurse and Midwife. How you all know through our INC website, the Lord Nigel Crisp, ex-Secretary of the National Health Services of UK, realized the importance of the nurses and midwives, especially in UK. He took up this issue to the World Health Organization. How best to commemorate the 200-year birth anniversary of the Florence Nightingale. That's how he was able to convince the World Health Organization, especially Dr. Tedros, the Director General of the WHO, to declare 2020 as an International Year of the Nurse and Midwife. Not only never stopped by getting it declared from the World Health Organization, he was able to capture the evidence-based nursing practices which are taking place globally, and they were able to come out for the first time SON report, that's called State of the World Nursing Report. And the State of the World Nursing Report, I think I must have shared this in many of the forums. You must have heard these themes, but still I would like to reiterate how globally these issues are, which is significant, and how India is also facing these issues and challenges in this nursing and midwifery sector. The theme of this State of the World Nursing Report is first, investment. The globe is telling to all the countries, you have to invest more money for the nursing and midwifery. That is the first theme which has been reflected in the SON report. The second theme is the creation of the nursing positions on the basis of the whatever the country's national nursing staffing norms are there. So they are asking all the countries to create the nursing positions. Number three, very rightly they have observed that how nurses and midwives, while working in the clinical setting, while working with the interprofessional team in the wards, the leadership skills is going to make an impact and outcome for the patient in the clinical setting. So they have said the leadership is one of the themes. And the fourth theme is service delivery. How a country can be able to develop the working conditions for the nurses and midwives. How certain policies have to be reflected in the pay commissions and all those things. How to attract the nurses to get into, this is the principle that WHO has given to all the countries. How to attract for nursing, how to retain for nursing. So that is that's how these four themes which have been reflected. Now not only WHO left it there by just producing the two reports. So what they did, they also took it as an agenda in the World Health Assembly. The World Health Assembly, you all know, 190 countries health secretaries, 190 countries director generals, and 190 countries health ministers. They go to in the month of May to the Geneva to attend the World Health Assembly to discuss the various issues and challenges globally in the health sector which is facing, and they come out with the solutions. So in that, the agenda after 10 years, World Health Assembly saw the agenda of nursing and midwifery. In that, they came out as a resolution called Strategic Direction for Nursing and Midwifery 21-25, SDNM 21-25. This is because the WHO works on the basis of the 4-year cycle. So now the WHO is going to ask all the countries these resolutions, to what extent you people have implemented and what is the way forward is going to be discussed again in 2025. So this is on this backdrop we are assembled here to discuss how we as a healthcare professionals faced during this COVID-19 and how it has affected our healthcare professionals, especially nurses and midwives, with the more work during the COVID-19, more burnout syndromes we have experienced, not having enough PPE kits, and isolation, stigma, and you have also seen how nurses are not given the accommodations. So all these issues our healthcare workers, especially nurses, have faced. So therefore, this World Health Organization also they have totally realized how the mental health issues, especially healthcare workers, with a focus on nurses and midwives faced in COVID-19, they have also assembled, they have come out with a various solution to the countries and to the WHO to advise all the countries they should address these mental health issues and they should make enough provision for the burnout syndrome and creating the more positions, and the staff welfare measures is one of the things which is going to be address. So now another good news I am going to tell you that, because at least I felt thrilled when about 3 days back, which I was informed, you are going to celebrate every year April 7th as a World Health Day. You know, we are all very used to celebrate April 7th. This is a World Health Day. In that World Health Day, the WHO has decided again the theme of the April 7, 2023 is going to be our nurses and midwives. See, it says the light on nurses and midwives, that is the theme, on the call of restless workforce that revolutionized the healthcare industry globally. So this is the theme. I think we are all going to work more on that, and very rightly, I think I am very happy to inform you, the Indian Medical Association, IMA, which is having branches all over the districts in the country, with the 4 lakh the medical professionals are the members of this IMA. The Secretary General, Dr. Nayak, is happened to be my board member in my Indian Nursing Council. He has already written to all the state branches to celebrate April 7th and inviting the nursing professionals and honoring them, and whole year some of the activities they have to perform for the nurses and midwives. How nurses and midwives are so important. If we, the physician and the nurses, if we work together, you can always see the impact and outcome of the patient outcomes are going to be much better. So therefore, we are, the opportunity is given by the World Health Organization to celebrate this April 7th. I think, sometimes I tell people, these 4 themes are very relevant, but over and above, this World Health Organization giving this April 7th as a theme is a really rewarding for the nursing and midwifery profession, and we should take it in a positive way, and again it should motivate us to work more for the whichever we are working, either in the hospital or in the clinic or in the rural area, and especially now you all know that our Ayushman Bharat, our Prime Minister of India, about 1,64,000 health and wellness centers which are there, and for the first time we are having a community health officer in these health and wellness centers. And who are these community health officers? I think 70% of the states, they have opted a BSc nurse as a community health officer. This has given in whichever the state when I go, because of this community health officer post, a lot of demand is coming for the BSc nursing, and because the Ministry of Health National Health Mission have realized how, because I think we had a very big deliberation in the Nirman Bhavan. You all know that there was a different program for the rural health work to be started. When they compared the syllabus of the BSc nursing, they realized the BSc nurses, they are having a comprehensive nursing and also primary health care has been dealt upon. That's why we have now passed the resolution that has helped for staffing in these community health officers. So therefore, this especially when this mental health issues, I think as Madam was telling, a lot of research has to be conducted. That's why I think she is holding a very important position, the National Nodal Officer for National Consortium for PhD Nursing. You know, this is I think you all know that how difficult to bring this model from Thailand, because when we called the Dasana Boontalk, was one of the lady brought through WHO fellowship to India. At that time we had only 6 institutions were providing the MSc nursing. Now we have 700 institutions are there. So when she told all these 6, she realized there is a need to connect these 6 institutions to produce the more nursing scholars. That's why we developed with the WHO, and the Rajiv Gandhi University of Health Sciences is awarding this degree. And a lot of, we are seeing many of our scholars are addressing the issues and challenges in the psychiatric nursing. And many of our scholars who have performed their studies, they have been included in the day-to-day clinical settings in their psychiatric units. So therefore, whatever the research comes out, we have to bring that outcome into the day-to-day delivery of the services. That will have an impact. And coming to the last thing which I would like to make appeal to all of you is, now that we are in an era of the trial and error, is no more is going to be in the learning. No, the common man who is there, he expects the quality of the healthcare. Now the buzzword is the quality of the healthcare. So in that environment, you cannot have a training of nurses in a trial and error where you have to go on with the patients. Now the era is the simulation. Simulation is a method of teaching now. The new era medical education is taking is the simulation. So we have brought that the National Referral Simulation Center from the Singapore model. We were able to improve it, and we have developed in the SGT. Many of people who have seen that, you may be able to realize how National Referral Simulation Center we have established. Now, before touching the patient, they are going to, because now whenever we students, when you go to the ICU units or to the OT sister is going to tell, don't touch. The fear started there. So that fear has to be removed. How to remove the fear? Just like toys, we want to use these equipments, so allow them to make any number of errors. So that this is an opportunity you can't have in the live patients. So this simulation provides this for our students to make errors, and they will be able to develop the competencies. That's why we have incorporated a simulation as a method of teaching in our revised BSc nursing syllabus. So before coming to this hall, I think we were having a dialogue with the Honorable Chief Minister Ji and also the Dean, that our psychiatric nursing, the 1-year diploma in psychiatric nursing, now the Indian Nursing Council has revised as a residency format. That residency format should be started here also, so that all the psychiatric patients should get an opportunity to get cared through the people who have been trained with the psychiatric nursing. So this provides an opportunity for the nurses working in those in the psychiatric units. They have agreed, and we are going to work forward to take this diploma in psychiatric nursing. Similarly, you all know that how nurse practitioner critical care 2-year residency program, which has been successful now. The ministry is already asking, they say you prepare 10 nurse practitioner syllabuses. They are after us. So now the ministry has realized they need more specialized nurses. Already we have psychiatric nursing practitioner program is also almost has been completed. So we want that at least Goa should also start this nurse practitioner critical care program, so that the new the critical care, especially during this COVID-19, at least the intensivist told me telephonically from Karad and also MGM Mumbai. During this COVID-19, the nurse practitioner and critical care people who have been trained, they came to handy to run the ICU programs. So therefore, I request the Honorable Chief Minister to take this forward. And I also feel that nursing has to be given a very important position. So we request you, sir, please take some nursing cell in the directorate, so that whatever some of the, I think once you are there, 2 or 3 people at least there in the directorate, they will be able to plan it, implement it, they will advise you how to take forward. I think without a support you will not be able to. So we as an Indian Nursing Council, I will be willing to provide any support. But Goa, one of the leading state in India, should developed state, should take some of the new innovative ideas and to have an impact. Ultimately, we are all working for the patient outcomes. For the common public, we will be able to deliver it to the quality of the patient care. With this, I hope you people, delegates who have come from different parts of the country, and definitely you are going to enjoy those social value of the Goa, and you will definitely enjoy it. At the same time, this academic, some research papers, our experts who are going to present, please take these messages and try to incorporate in whichever the setting you are working, try to integrate it so that will have an impact. Your patient will be satisfied, and as a job satisfaction, ultimately we should have a job satisfaction. So if you don't have a job satisfaction, outcome will not be there. So wish you best of luck. Thank you very much.
Thank you, sir, for sharing valuable information on current issues of nursing profession and on stressing on the quality nursing care with simulation. We are inspired by your action and experience. We look forward in anticipation to celebrate the World Health Day, 7th April, with great enthusiasm. We have amidst us a dedicated professional with a dynamic and influential personality, who has made great contribution in the field of medicine. He is the Dean of Goa Medical College and Hospital, Dr. Shivanand Bandekar. So we are glad to have you here and request you to share your thoughts on this occasion.
Honorable Chief Minister of Goa, Dr. Pramod Sawant, Honorable Council President, Sri Dilip Kumarji, Madam Ridhima, Dr. Bala, Dr. Radhakrishnan, my own friend, Dr. Wilson, Principal of Nursing College, all the distinguished invitees, delegates, faculty members, and dear students. I know only one thing, that Indian nurses are the best in the world. And I dare anybody challenges me. Because I have my classmates working all over the globe. And whenever I ask them, how is nursing in your country? They say, there are nurses, Indians are the best. This also tells me that my nurses are also best in the world. Working in the Goa Medical College and the Institute of Psychiatry. And let me share with you, when it was a COVID time, I wouldn't have succeeded without the strong arm of nursing group. So they were all with me. Not only nurses, but the third year nursing students were also with me. It was not a joke to handle COVID, because especially when we saw the second wave with Delta virus, it took human race by surprise, and we were finding scarcity of medical professionals. The nurses stood by my side and they said, we will do the job of critical care personnel. And sir, your request of starting nurse practitioner course in critical care was also lingering in my mind, because we have so many ICUs. We have MICU, we have SICU, we have AICU, NICU. All these ICUs, they need a nurses with dedicated approach. And I will take this forward with the help of our Honorable Chief Minister and Honorable Health Minister. As regards the curriculum, when I took over as IPHB Director, from that year we have started 10 seats in Psychiatric Nursing Diploma, 5 seats in MSc in Psychiatric Nursing, that is a postgraduate degree. But to our surprise, we do not get people to take these courses. So today I will use this platform and this annual conference to please take this message home, that convince your people, your friends, your colleagues to take Psychiatric Nursing Diploma, because when you look at the mentally ill patients, they really need a good, experienced nursing care. As Madam Ridhima shared with us, many a times we see these patients with fractures. They come to our OPD, and sometimes the relatives are not there with them, and these patients are, they really suffer. They have pressure sores, bad sores, and if you look at their personal hygiene, it is very bad. I hope through this conference, you will delegate through all those aspects of mentally ill patient and come out with the best solution. And when you come out with the best solution, let us meet in IPHB and again improve the patient care. I wish you all the success for this conference, and I hope the people who have come with academic mind will enjoy the academics. People with social mind can go to Bambolin Beach, which is very near, and enjoy the evenings, because Goan beaches give you a lot of peace of mind, and then you will go back with very pleasant memories of Goa. Thank you for inviting me.
Thank you, sir. This was really encouraging and motivating. We feel appreciated and assure you to be at service in times of health crisis. I am profoundly delighted to take this opportunity to introduce the chief guest of this evening. He is our very own Honorable Chief Minister of the State of Goa, Dr. Pramod Sawant. His Excellency has numerous high-level achievements and credits. Sir has been Chairman of the Gomanchal Farmer Cooperative Society, of Goa Youth Multipurpose Cooperative Society, of GSIDC Government of Goa, and of Sai Nursing and Paramedical Institute, Sankli. His Excellency has been bestowed with State Youth Award, Panjim, and the Goa State Self-Help Federation Award. Sir has twice served as MLA of Sankli constituency, an ex-speaker in Goa Legislative Assembly, and an active in social work, and currently holding the highest position in the state of Goa, Honorable Chief Minister. We Goans have experienced his leadership, which has a touch of giving us hope, a crucial factor for mental well-being. Sir, we are well aware of your schedule and take this opportunity to thank you for being here. Your presence has given a remarkable standard to ISPN, to the Institute of Nursing Education, Bambolin, and to this event. I invite you, sir, to address this gathering.
For the 22nd Annual Conference of the ISPN, along with me, the Dean of Goa Medical College, Dr. Bandekar, Dr. Dilip Kumar, the President of Indian Nursing Council, Dr. G. Balakrishnan, Joint Secretary of the ISPN, Dr. K. Ridamma, the President of the ISPN, and Dr. J. Radhakrishnan, General Secretary of the ISPN, and Dr. Wilson and Fernandez, the Principal of the Institute of the Nursing Council. Good evening, my friends. I am happy that the 22nd National Conference of the ISPN conducted in the Institute of Nursing Education, Bambolim, between 24 to 26 on the theme, the role of nursing in promoting the mental health lifespan approach. I, being a health professional, would like to compliment the organizers for choosing the very appropriate topic in the current health scenario. The mental health is essential for complete well-being. I am very happy to see that more than 250 delegates from the various parts of India. I am sure the 3 days deliberations will enrich your understanding on the theme. As I learned that ISPN has a unique contribution to the psychiatric nurses and nurses of India in general, and with the 2,500 active members in the society. It's pleasing that the organization has conducted the 21 regular annual national international conference at the various cities in India. It's heartening to note that the society is also publishing the Indian Journal of Psychiatric Nursing biannual, which is then recognized as the journal in UGC Care list and a renowned nursing journal. While mental health has been a rising concern for all, we are now seeing an exponential rise in the cases of online distress. The technology uses and surged ever since the pandemic, with everybody being vulnerable to the cyber threats. Online distress has triggered the various mental health issues like depressions and internet addictions. The role of mental health care givers and will be the crucial to retain the balance with the society. They now need to also work as a cyber care givers and so as to help the people to cope up with the technology. And I strongly believe you all will be the most important interventionist to ensure the mental being for all. Nursing is a profession and which is always been respected the day by day. The requirement of the nursing services is increasing all across India. We all know that you are working for 24/7, and I would like to salute you for your work, devotion, profession, especially during the COVID time. We have more and more medical college and hospitals being set up, and for that the nursing force is required. The Government of India is under the leadership of Honorable Prime Minister Narendra Modi ji is promoting the health for all in every nook and corner of India. And the demand of the Indian nurses has been growing multifold all across the world. We all know that the famous statement that you will find the nurses from the Kerala in any part of the world. This is because of our hospitable and serving nature, and especially the knowledge of English and other languages too. The advantage that India has a demography, we are the youngest nation in the world, and hence there is a need of nursing facility all across the world due to their aging population. Earlier we used to have more female nurses, but today we find that the males are also have been coming into this profession in large scale. Congratulations for them. I would like to mention that in my own experience, I had started the Sai Nursing Institute, the small institute in my own constituency in 2014 with the A&M course. It is very difficult for me to convince the students to take the admission for the A&M profession. So hardly the 20 students, they took the admission during the first year, 2014. But proudly, today I am saying, this year I have started with the BSc Nursing and GNM Nursing. With the help of Indian Nursing Council, Goa Nursing Council and all our medical faculty, those who are on the council, especially the council's member. And I announced that total admission, 66 admission is full for the BSc and for the GNM. So this is only the profession that gives the 100% job guarantee and a placement. So I will therefore urge the organizers to propagate the message among all the youth to take up the nursing as a career. I am delighted to mention that Goa has been the first state to launch the India's first cyber clinic, cyber wellness center in Panjim since 31st of May 2022, initiated by a Responsible Netizen, a non-profit organization working towards the protection of online safety right of children and adults. The Cyber Wellness Center is a holistic center that focuses on ensuring the mental well-being in a cyber space to combat with the online distress. The center provides the preventive services through the education and empowerment to the children and adults about the online safety protocol and provides the healing to victims of online distress. The center provides the free of cost counseling, therapy to minimize the damage caused due to the cyber threats and provides the legal and technical supports to victims. The center also provides the interventions to the internet-based addiction. That first center in the state of Goa, which is under the Responsible Netizen, they have started in the state of Goa. This conference is conducted at Goa in collaboration with our state-run institute with the nursing education. I am sure this will be the mutually enriching experience for both ISPN and INE. The deliberations that you will have in this conference will go a long way in helping the health sector in a big way. Goa is an international tourism hub. I wish the members to visit the places and enjoy the diverse nature of the Goa and food and flavor too. Wishing the Indian Society of the Psychiatric Nursing, ISPN, a great success in all their future endeavours. I wish the Institute of Nursing Education also Goa to achieve the many more success in their educational pursuits. Thank you very much.
Thank you, sir, for enlightening us on current issues of mental well-being and the various actions adopted to tackle them, such as Cyber Wellness Center. The hard work and dedication offered to the upliftment of communities' well-being demands appreciation. This occasion is an auspicious one to felicitate our leaders who have inspired various networks with their profound contribution. May I request Dr. K. Redima, the President of ISPN, to felicitate His Excellency, Honorable Chief Minister of Goa, Dr. Pramod Sawant. For this, I request Madam Maria Ferran and Madam Konkani to assist in the process. Thank you, Madam. I now request Dr. Radhakrishna Govindan, the General Secretary of ISPN, to felicitate the President of Indian Nursing Council and Patron of ISPN, Dr. T. Dilip Kumar. I call upon Madam Konkani to assist in the process. Thank you, sir. I request Dr. Wilson Fernandez, Principal Professor of INE, to felicitate the Dean of Goa Medical College and Hospital, Dr. Shivanand Bandekar. I call upon Marie Ferran to assist in the message. Thank you, sir. To make this event a memorable occasion, many eminent individuals have coordinated their efforts to bring an applaudable success. This affirms our need to express gratitude. And to do the honors, may I request the Principal and Professor of INE Bowling, Dr. Wilson Fernandez, to propose the vote of thanks.
Each time we say thank you